This is Washington Watch, and I'm Tony Perkins, your host. The website is tonyperkins.com. In an updated report published yesterday, the Centers for Disease Control and Prevention estimated that the Omicron variant made up about 95.4% of new COVID cases in the U.S. last week. Now, that was up from 59% the week before. These numbers are on the rise, not just because the unvaccinated are contracting COVID, but so are the vaccinated. Despite this, President Biden remains committed to his talking points.
There's no excuse for anyone being unvaccinated. This continues to be a pandemic of the unvaccinated. So we got to make more progress.
Can anyone really say this is a pandemic of the unvaccinated? I mean, honestly say it is a pandemic of the unvaccinated. Joining me now to talk about the problems with this and other talking points being used by the administration is Dr. Bhattacharya, professor of medicine at Stanford University and one of the authors of the Great Barrington Declaration, a statement advocating an alternative approach to COVID-19 and the pandemic. Dr. Bhattacharya, welcome back to the program.
Great to be here.
So what's your take on this pandemic of the unvaccinated remark by the president?
I think it's very irresponsible at this point in the pandemic to stigmatize people who are vaccinated or unvaccinated. Many of the unvaccinated had previous COVID, recovered from it, and actually have better protection against infection than the vaccinated. I don't think either the vaccinated or the unvaccinated should be stigmatized. And I think to call the pandemic, that at this point, a pandemic of the unvaccinated unfairly stigmatizes a group of people with no discernible purpose as far as public health goes.
And doesn't this even further make this more of a political issue than a healthcare issue, which it is? Absolutely.
I mean, it absolutely does. I mean, I think if you think about how one should approach this from a public health point of view, it should absolutely be depoliticized. Public health is not actually, at least inherently, a political topic. It's a topic that affects every American, but every world citizen, regardless of your political, and to use the pandemic the way that President Biden seemed to be doing yesterday as a way to gain political points, I think is a big mistake. And we've seen this, unfortunately, through much of the pandemic. It just undermines confidence in public health and reduces its ability to provide good information, trustworthy information that people will take seriously.
And just another disclaimer for those that may be new listening to the program, I'm an advocate for those that want to get the vaccine. I think the vaccine makes sense, depending upon what you and your healthcare provider decide, but not what the government tells you. I'm opposed 100% to mandates, but all in favor of people who need the vaccine getting it. Now, along those lines, yesterday in his remarks, the president also talked about children and said what's best for them is vaccinating them. Is this what kids need the most right now, is getting them vaccinated? He also said if you should keep people who are unvaccinated away from your children.
It's so unfortunate. I mean, I think what kids need most now is normal life. We have deprived them of normal life, interactions with other kids, normal school. We filled their lives with fear, and it's a mistake. We should not ever have done that. You may have a child that needs the vaccine. Generally speaking, I think the vaccine is less warranted in children than it is in older people because children have so low risk of severe outcomes if they were to get COVID. So it's not clear that, I mean, it's something that should be left up to the medical provider and the parent, right? COVID is very far from the most important threat to the health and well-being of kids. I wish he'd gone up there and said that for the most important thing for the health of your kid is to get back to normal life. Let your kid start being kids again.
It's a really good point, Dr. Bhattacharya. I want to ask you that question. At what point, I mean, we're almost, 2 years into this? At what point will we realize we're just going to have to coexist with this? We're going to have to learn how to deal with this as we have the flu.
I mean, we've been at that point a long time now. We should have been telling people about tools to get back to to get back to normal life almost from the beginning of the epidemic. I think especially now that we first are in basically, I think we've disabused of ourselves of the illusion that we can protect ourselves from getting COVID. I mean, Omicron, that was true before Omicron, but certainly with Omicron, I don't think there's anyone out there that should harbor the idea that they're not going to eventually encounter COVID.
One final question for you. You made reference to the natural immunity that's out there by those who have had previous infections. Is there greater elasticity for those who have the natural immunity as opposed to the vaccine as we're seeing these different variants come along?
I mean, I think Omicron seems to evade both natural immunity and the vaccines in terms of getting infected. Lots and lots of people who were previously infected and also lots and lots of people who were vaccinated are now getting Omicron. But what they're finding is that the severity of the disease is much, much less than the previous infections were. And so the disease now is defanged. We've decoupled cases from severe outcomes. It is far past time to get back to normal life now.
I am with you on that, Doc. We got to get back to life as well. I'm not sure there is a normal. Even if it's a new normal, we need to get back to it. Dr. Bhattacharya, thanks so much for joining us. Always great to talk with you.
Thank you.